saying we'd rather be stigmatized for diabetes or something else as opposed to having a mental illness.
Correct.
Okay. Why do you think that is? How did it get that way? Because like you said, it's just like any other illness. So why is it that people pick on, if I can use that term, mental illness?
And I always say this, I think the media has a lot to do with it. Hope I'm okay to give an example. When the guy stole the ambulance, the first thing the news person said was, he must have a mental illness. He never said if he could have been on drugs. He never said if he could have been on alcohol. That was the first thing he said. And I think that that's a big thing. And I think just not being educated.
So you mentioned the media. So when you're saying that they put out wrong information, is it? Or they just always talk bad about people with a mental illness? I don't understand when you say media.
I think they talk bad about people with a mental illness. Because like I say, anytime anything's happened, schizophrenia, but someone actually could have schizophrenia, but my thing is I always talk about, are they in the right treatment program? Are they taking the right medicine? Are they actually doing what they're supposed to do? So people don't know. Again, people are just not educated.
The media, I always say that a lot of things have been going on always. There's nothing new about it, nothing new under the sun. But the media perpetuates negative things, such as a statement about things. And I have noticed lately that the people with mental illnesses and the media are trying to form a positive thing, because they're talking about bipolar depression and how it actually feels, And now whether people accept it or not, but I do appreciate the fact that now there are people coming out. Now, and I guess because if it's a star, then it's acceptable. If you or I got up there and said, today I feel like I can't function, because there are days that I can't function, and I tell people that and they don't believe it. They think that you are lazy or even you're avoiding things, and so I'm thankful, I'm glad that people, even though stars, are saying, today I can't function, so they can understand that it's true. It's true. And it don't have to be anything physically wrong with you at all, but you just cannot sometimes get up. That's me. I just can't. And you don't want to.
And it goes back to what you ladies were saying earlier. It's kind of people not educated, because and it leads into the stigma, because you don't want to say to people that I just don't feel well. Sometimes, because you don't want people to think you're lazy, so some people, they'll struggle through until they hit a wall, and then they wind up in the hospital, or things are worse, where if they would have just got treatment.
And then our jobs. Jobs, you can't go on the job and say, I don't feel good. Just that you get a certain amount of sick leave days or whatever, and you just can't say, I don't feel good. And then after the third day, you have to come in with some doctor's thing. And in some instances, that may be good, because you may go get some help, and then the doctor says, therapist, psychiatrist, that you shouldn't be at work. But it's back to it again. It's a label. It's a stigmatism. I know that I had to crash on work before I could get help and get off. You're just steadily trying. You're steadily trying. You go to work late. That's bad. That's against you. You take off Monday and Friday, as they say, and sometimes this is wrong, but sometimes you are sick. You have a mental illness. And then the supervisor who's running a job, or the boss who's running a job, he's saying, well, that may be all good, but I can't have you on my job because I need you. So you just caught in a rock and a hard place, And then the medication, as you said, you got to get the right medication. You get the medication, and it takes 21 days at least for it to settle out in your system. So you go to work, you can't think, you can't function, you're sleepy, and it's a whole bunch. And for me, one time, I didn't even know where my desk was. We all medicated up. I was on the wrong floor, at the wrong area, and that frightens you, So then, like I said, like the people say, she said that something's wrong with you, just got a mental illness. I went into my job, I said, I'm gonna go. I'm fighting to go. Got in there, pushed the button for the elevator, got off, and I said, this don't feel right, Looked at the floor, this ain't the color rug, and this is medicine. This is medicine. And then when I got to the area where my desk was and I saw somebody there, and I'm like, okay, this is not right. And I had to leave. So then you get to the supervisor saying, I thought you was coming to work today. Can you tell them that I was there? I didn't know that was going on. So medicine is good. And then when you get the wrong medicine, backtrack, the wrong medicine, you're getting treated for schizophrenia, but you're not schizophrenic. Those medicines are not the same thing. So it can make it worse for you. And I hear on the news, and I know I'm rambling there, but I hear on the news where they say, take this medicine for depression. But if you feel suicidal, okay, then contact your doctor. They didn't give you this medicine for depression, and then you will feel like suicide. Yeah.